Have you ever looked up at the sky and wondered, what if I could fly around like a bird? Or have you ever looked at your speech test and wondered, what if I could change this into an A+? Well, I hope the answer to both those questions was yes, because today we're going to be looking into lucid dreaming and how it works. Before we get into lucid dreaming, however, let's talk about dreams. What are dreams? Well, dreams are a way for our bodies to rest and recover from activities we experience during the day, and a way for our minds to consolidate memories from the day, from short-term memory to long-term memory, so we can keep them for a longer period of time. Dreaming occurs naturally as a part of our sleep cycle, and there is much anthropological evidence to suggest that dreaming was once a survival mechanism, allowing us to simulate dangerous situations and react to them safely, and without actually putting ourselves in harm's way. This survival mechanism dates back to the days of the cavemen. The cavemen would have had to deal with matters of life and death on a daily basis, and those that were able to dream would have been able to plan ahead for it, and therefore they survived to pass on the trait to us. The human sleep cycle occurs in 4 distinct phases. 3 stages of non-rapid eye movement sleep, followed by 1 stage of rapid eye movement sleep, or REM. The first phase of sleep is non-REM phase 1. This is the lightest sleep phase, and most people will report that they weren't actually asleep if woken up from it. Spatial awareness is only slightly dulled at this phase, as it's more of a transitionary phase between reality and sleep. Followed by this is non-REM phase 2. During this phase, awareness of the surrounding environment drops, along with body temperature and pulse. Pulse and breathing also become more regular and rhythmic. That familiar up and down movement of a person's chest while sleeping occurs during this phase. A single cycle of phase 2 lasts approximately 20 minutes, and it comprises approximately 50% of your total sleep time. The third phase of sleep is non-REM phase 3. This phase represents the deepest sleep you can enter during a sleep cycle. The brain becomes very inactive, the muscles relax, and stimuli is not readily responded to. This is not to say the body doesn't respond to them at all, but more that sleep is only subtly affected by them. Sleepwalking can also occur at this phase. This is followed by the 4th and final sleep phase, REM sleep, or rapid eye movement sleep. It is during this phase that dreams occur. It can be characterized by high brain activity and visible movement of the eyes underneath the eyelids. External stimuli has been observed to have a major effect on dreams during this phase. For instance, telling a person who is currently in REM sleep a horror story may cause them to experience nightmares or night terrors. Vital signs can also fluctuate, and sweating may occur during this phase based on dream stimuli. Bedwetting and wet dreams may also occur during this phase. This is also in part due to partial body control, which will be explained in a minute. It should be noted, however, that sleep comes in cycles and doesn't move through these stages in chronological order. For instance, sleep may start at non-REM 1, then move to REM sleep, then revert back to non-REM 3, non-REM 2, back to non-REM 3, maybe back to REM at some point, and occasionally back to non-REM 2. Typically, however, non-REM 1 and non-REM 2 are usually only reached when falling asleep or waking up. Both are triggered by the body's circadian rhythm, much like an internal body clock. During phase 4 of sleep, that is, rapid eye movement sleep, the pons, an area of the brain in charge of circadian rhythm and, in part, sleep control, semi-paralyzes the body to avoid dreams being acted out in real life. However, if sleep is disturbed during this phase, a person may end up with sleep paralysis. Sleep paralysis occurs when a sleeping subject is woken just before, just after, or during REM sleep. If a person is woken up suddenly by external forces or internal forces in their dreams during REM sleep, they may wake up with sleep paralysis. A subject in sleep paralysis will be awake and conscious, but unable to move their own body and limbs. Due to the subject having just been in a highly mentally active state, hallucinations are common during sleep paralysis episodes. Usually, they are of figures or eyes in the darkness just beyond their field of view. This situation can be extremely traumatic in themselves. This aside, typical dreams are usually constituted of thoughts, experiences, and fears a person may experience during their day. These fears, however, in the modern day, are less about life and death situations as much as they are about perceived threats and perceived fears we experience during day-to-day life. For example, social anxiety, threats to our job and livelihood, or threats to our relationships with other people. These concepts are all related to the concept of the ego, a Freudian psychoanalytic term describing the subconscious self, which balances primitive desires for pleasure and gratification with social and moral inhibitions. The ego gains pleasure by making the right decisions, but when it makes the wrong decision, it can experience anxiety and guilt. To counter this, it deploys what's known as a defense mechanism. The gist of this concept is that deeply traumatic or negative memories become repressed and locked away, so we no longer have to deal with the trauma and fear they induce from day-to-day life. These sort of suppressed memories can reawaken in part or in full during REM. A good example of this is Cobb from the film Inception, whose repressed memories of his wife dying reappears and influences his other unrelated dreams while he's asleep. Okay, so those are dreams, but what makes a dream lucid? Well, a lucid dream is any dream in which the dreamer becomes self-aware. That is to say, they realize they are dreaming and begin to influence and control the dream through their own willpower. Whilst traditional lucid dreams have the dreamer controlling all aspects of the dream, some lucid dreams are simply the subject observing his dream lucidly, but without influencing it. This allows him or her to observe the dream in greater depth and recall more after waking up. So, hang on. Isn't lucid dreaming just using my imagination? If I can do this normally, what's the point of a lucid dream? Well, not quite. Whilst it is true that a lucid dream involves imagination, entirely within the brain, lucid dreaming is a time when you may focus all your brain power solely on lucid dreaming. Whereas just imagining things only uses a part of your brain, since the rest of your brain still needs to process stimuli and control your physical body. A lucid dream also unlocks many hidden or suppressed facets of memory locked away in the temporal lobe in the brain. These memories can only be viewed and interacted with properly during dreams, and lucid dreams simply add the means of controlling them and getting greater observational depth and retention to a normal dream. Well, that sounds great. How do I start lucid dreaming myself? It's not quite that simple. To lucid dream, you must first have a regular and controlled sleep cycle, so as to maximize time that can be spent in REM. After you've established these regular cycles, you'll need to start doing regular reality checks. The best way to do this is to have a psychosomatic catch, something which prompts you to ask the question, am I dreaming right now? Typical objects used by people as this form of psychosomatic catch includes tattoos, symbols, or words which frequently appear in conversation. It is important, however, not to use times or anything which is regular or scheduled, because you are essentially trying to catch your brain off guard with these reality checks. Eventually, after performing reality checks more often, you'll find that at one point, you'll do one within a dream. And when you ask yourself the question, am I dreaming? Your answer will be yes. After you've established the dream in this way, comes the hard part. You now need to maintain control over the dream and remain lucid. You must exert willpower and need to stay fully aware of your surroundings. And, if dreaming observantly, must not interact with the dream. That is to say, you can't manipulate or change things within it. Losing lucidity, or allowing your subconscious to take back part or full control of the dream, can result in a state of dream entropy. This blurs the definite line between reality and dream, and results in what's known as depersonalization disorder. Depersonalization disorder can be extremely dangerous, as it affects your perception of what is real and what is not. A common byproduct of this is hallucinations and a lack of conscious control over your own actions during normal waking consciousness. To off-put this slightly, it can be helpful to wear some item of clothing, a bracelet for example, in public. This includes in reality and during dreams. This object is also a psychosomatic catch, but not one which prompts you to do a reality check. In this case, it asks you to act sensibly in case you're actually in reality and do not realize it. Many people pursue lucid dreaming as a hobby and use these methods to reduce the likelihood of depersonalization disorder. Beyond its uses for personal enjoyment, however, lucid dreaming can also be used as a form of therapy for certain medical disorders. In much the same way lucid dreaming can make repressed memories unrepressed and tangible again, psychotherapists can do the same via hypnosis. Hypnosis activates a relaxed but mentally active state, similar to REM. REM sleep may be more potent and allows full subject immersion, but hypnosis still allows partial viewing and interaction with certain thoughts and memories that are repressed or otherwise inaccessible consciously. We occasionally see this method being used in Hollywood, as the archetyped psychoanalyst gets their patient to sit down on a sofa and talk about their childhood. Hypnosis and psychoanalysis can be extremely important in understanding and then treating mental trauma in patients with disorders such as PTSD, anxiety, depression, and to an extent, it can also be used to understand the causes for certain personality quirks and idiosyncrasies. To sum up, lucid dreams are you taking control of an ancient adaptation your ancestors used for survival and bending it to your own will. The only person who knows more about you is you in a dream. So what could you learn from yourself? That's the end of the video, guys. Thanks for watching.